Welcome, everybody. For those of you who don't know me, I'm John Cleamer. I'm one of the Norfolk Care Association directors, and I drew the straw for chairing this session this time. We've got a relatively compact and easy to manage agenda, fingers crossed, so hopefully lots of time for questions and discussions, bearing in mind the focus is on fees and fees reviews, which tends to be a topic that is important to a lot of providers across the sector. So yeah, first session of this, we're going to hand over to Becky, who's going to go through some of the feedback that you've provided in terms of the fee review process. Then I think Leon's going to give us a little bit of an update on that from a finance perspective. Then we'll do a Q&A with Becky and Leon in terms of kind of questions for them. And then we will kick Norfolk County Council colleagues out of the meeting so we can kind of have a discussion around just providers if anyone wants to raise anything in that bit. Perfect. As I will no doubt forget at the end, we've been asked to promote some of the, Alfina, give me the right name for what I'm promoting.
Join the Shaping the Market webinar with Norfolk County Council. I'll just put a link and some info in the chat.
Perfect. So just to draw your attention to that, if of use and of relevance, please do go along to that. And with that out of the way, Becky, I'll hand over to you.
Okay, great, thank you. I've got the slide deck, which I'll share from my screen in a moment, if that's okay. So good morning, everybody. I'm Becky Brown. I'm the Market Development Manager in the Commissioning and Care Markets team at Norfolk County Council. I'm here with a couple of other colleagues today. I can see Leon's here. I'm sure Abby is in the room as well. Should we just do some quick introductions now, and then I'll share my slide deck. So Abby, are you there?
Morning, everyone. Hi, thanks, Becky. I'm Abby Harriton, one of the commissioning managers working in the Commissioning Care Markets team for Norfolk County Council.
Well, glad that you're there, Abby. I think Chris Jones is here as well. Are you here, Chris?
Yeah. Do you want me to introduce myself?
Yeah.
So I'm Chris Jones and I'm the Assistant Director for our Commissioning Care Markets team, and I'm working with Becky and Leon and colleagues on this year's fee uplift review process.
Great, thank you, Chris. And Leon?
Good morning, everyone. I'm Leon Ring. I'm the Finance Business Partner for Adult Social Care and Public Health at the County Council. Look forward to the discussion today.
Well, thanks very much. So we're here today to talk to you all about the annual process that we go through in terms of setting fees for the next financial year, so from April next year. We've got a few different colleagues here that are in the room today, so it's a good opportunity to have a discussion and ask any questions that you might have. We're going to start momentarily with Leon. He's going to take you through just a few slides that's looking at the wider financial environment that we're all operating within, and sharing some of the information about what we do know and what information that we're still awaiting for that's going to help us make some decisions around the fees for next year. And then Abby and I are going to pick up some of the findings from our sector pulse survey that we put out to the market last month. So thank you to anybody that's completed that survey that's in the room. We'll share some of those findings and give you an opportunity again to just let us know whether or not that feels as though it's reflective of your own experiences. And as John mentioned, there'll be opportunities to ask questions, but I'm quite happy for it to feel quite informal as much as possible. So if you've got a question as we go, do feel free just to ask that question, or likewise come in at the end. Either way is totally fine with me. So I hope that all sounds okay. We'll start with Leon, and let me share our slide deck if that's okay, Alfina. I'll try and bring that up now. Wonderful. I'll drive the deck for you, Leon. Over to you.
Thanks, Becky. And yeah, good morning again to everyone. It's that time of year where the leaves are starting to turn brown, fall off the trees, and we're here talking about fees again. So it comes around really quickly every year, but something that we generally look forward to in terms of having that dialogue with yourselves, and really appreciate either the feedback today, that you've provided in the survey. So thank you your continued engagement, and that is part of our duties under the Care Act to make sure we really understand the costs of operating any of our social care services that we commission. So really important to gain that feedback. I guess slightly spoiler alert, but for those of you who've been on this session this time last year, the slides are really similar. So we're not reinventing the wheel, and much of the challenges that we described 12 months ago are still very much real today. The one certainty that we all face in terms of local government or adult social care is the uncertainty that we face on a daily basis. So the slide outlines, as you'd expect in local government, we still face financial challenges. So despite our central government changing from Conservative to Labour, we still, as a local government, find ourselves constrained by our finances, not just in adult social care, but and not just in Norfolk. It's a national issue in terms of the number of local authorities that are asking government for what we call exceptional financial support, which is at the pre-stage to effective bankruptcy for local authorities. So that still becomes a very real issue. We in Norfolk are not quite in that stage yet, but it's a real sort of challenge for us.
Leon, John's just put a question in the chat just for kind of context around some of these numbers. So the specific question is, how much is the 59 million as a percentage of total adult social care spending? So again, just you go through, it'd be helpful to kind of, particularly when we talk in the millions and the billions, it's very hard to sometimes kind of grasp what is that percentage-wise relevance to the local Norfolk context.
Yeah, I have to, and do please, ask questions as we go, either through the chat or jump in at any time, because it's really helpful for you to ask that clarification. So 59 million is about 20% of our net budget. So our net budget is 300 million. Our gross budget is about 700 million. So that puts that into context. So yeah, just under 20%. So I guess the challenge remains. We've delivered a number of recurrent savings over the last 7 or 8 years. So totaling over 100 million. But that demand financially is still there. Typically adult social care is about 40% of the council budget, and therefore that's the target that we are asked to deliver year on year, and therefore we still have that financial challenge going forward. So at the moment we're being asked to find another 28 million of savings for 26-27. So that's our planning context. The other bits, obviously, in terms of local government, before I sort of touch on some of the other bits of the slide, would be for those of you who are not close to our local politics or national politics, is the two things around local government reorganisation. So for those not familiar, by April 2028, Norfolk County Council, as it currently exists, and the 7 districts that are in Norfolk won't exist in the same format. So we are going through a process where coming out at the end of that will be either 1, 2 or 3 Unit 3 councils that support all of Norfolk. And obviously for adult social care, that will mean either 1, as we currently are, or 2 or 3 social care departments. So some of the sort of the national drive towards changing how we do politics at a local level. And equally alongside that, we've got our devolution agenda, which will kick in very shortly. That will create a new organisation across Norfolk and Suffolk, and an elected mayor across Norfolk and Suffolk. So the politics is sort of changing, and the governance of how we operate is equally changing. So equally in the slide, we all know about the economic conditions. So despite inflation slowly coming down, it's still higher than many of the estimates, and we know within there individual pieces are individual prices are still continuing to be challenging for us all, both privately and professionally. Don't need to tell you guys about sort of the aging demographics of Norfolk. We know North Norfolk in particular is one of, if not the oldest population in the whole of the country, and therefore that's a continued challenge for us in terms of how we support that aging demographic, and equally within there the complexity of needs that people who are now living longer have in terms of both health and social care.
The question I had, so just to kind of fill hopefully a moment, was I saw there's the quality line, I think, was kind of next about, this narrative that Norfolk is kind of behind the benchmark in terms of particularly kind of good and outstanding. I think the last conversation I had with Lou suggested we'd seen some relatively significant kind of change in that, particularly around our regional kind of colleagues. And I think with a bit of recognition that given the CQC backlog in inspections, that actually PAMS was a much more sensible comparator rather than CQC. Is there any kind of update on that position, really?
Yeah, I think what you're saying there is absolutely right on. So this slide is probably slightly out of date, and in the oversight of updating it, that's probably one that's slightly out of sync. So I think when we describe the overall quality of the care market, then absolutely, based on our PAMS assessments, which you'll all be aware of, we are now moving towards being in the middle of the pack in the region as opposed to towards the bottom end of it. It's slightly different for each of the care markets, whether it's residential nursing or home support, and I don't quite have those numbers in front of me, but as a care market across the whole of Norfolk, then we are moving in a positive direction. So that's really great. So obviously what we did have was, a worrying bit around, the underlying care quality that we were experiencing, but that has improved.
It has a little bit, Leon, and I think the latest position that we are seeking to outline in the NPS is that we've sort of moved from 74% up to about 76% of provision that's rated good or better. And we're resetting our aspiration around what we would want from a quality assurance perspective, John, to be much clearer about where we would want to be in the next sort of 12 to 18 months or so. And really, we're taking away the sort of ring fence around the percentage that we want to see. We want to see the whole market moving in the direction of travel towards good or outstanding. So we'll be clear about that when we publish the NPS in terms of what our aspiration is around the quality, but it has got better.
Perfect. As that was largely a filler question, we have got the slides back up.
Covered that perfectly, thank you.
So
I think
Becky, I don't know if you or Chris want to just make sure Alfina's got a copy of the slides separately, so if we have any tech issues we can recover a bit quicker. And Leon, carry on.
Thank you.
I'll have a look for them and see if I can pop them over to Alfina, John.
Thank you. Right. So last couple of bits I didn't quite touch on so far as obviously workforce and the so significant viability and sustainability issues, and you guys know far more than me, so I'm not going to tell you what you already know in terms of your workforce issues, and hopefully slightly improving position in some areas, but I'm sure it's still an issue for you all. And obviously central government are changing some of the terms and conditions that you all need to operate within. So some difficult, challenging legislation pieces that are working its way through the systems at the moment. So that's context. Hopefully all of it's sort of broadly familiar, relatively similar to what we've experienced in adult social care for a number of years. Of course, what we still have is the dangle of hope into the future around social care reform. But if I was a gambling person, which I'm not, I wouldn't be waiting for that to be the white knight on the horizon. So in terms of the actual budget, it's difficult for local government because we don't receive the information in a timely way to truly know what our funding is going to be until quite late in the process. So as I sat here sort of 12 months ago, the government still haven't produced any information for us as a local authority to say what your budget will be for 26-27. So we're working with sort of best of endeavours, best estimates of what our funding may look like, and we start to get more signals when it comes to the Chancellor's autumn budget and what we call the policy statement that sits alongside that. And that will give us a bit of an indication, but won't give us the complete clarity. So it'll give us a direction of travel. The other piece that's slightly uncertain at the moment is a government committed to doing something what they call fair funding, which is not necessarily looking at the size of the pie, but how they cut the pie across the number of local authorities, and that will look at how much goes to shire counties compared to metropolitan authorities, etc., and what proportion comes to the south of the country or the east of the country versus the north of the country. So we await the outcome of that, and that will enable us to do a little bit more planning. And equally alongside that, government have committed to giving us a 3-year settlement. So hopefully when I sit here in 12 months' time, I'll have a little bit more certainty about what the funding ahead of us looks like. So they give us a certain statement for this year and then a provisional for years 2 and 3. So the gap we sort of touched on earlier. So as an NCC, we've got a 62.5 million funding gap at the moment for 26-27, but obviously that's based on the estimates of what our funding may look like, and the adult share of that, as I mentioned, was circa 28 million of savings that we'll need to find. So degree of uncertainty as we sort of look forward.
So roughly, Leon, just to give that context based off, so that's around 10%.
Yeah, absolutely. About 9% of the budget for next year, 9% of our net budget. So that's
and that's an expected in-year saving, or is that over a period?
So the 28 million is just in the year. So over the MTFS, you're looking at upwards of 90 million over the 4-year period. Of course, what I would clarify is that that's not going from 300 million down to 270 million. That's just the savings bit. We obviously then putting growth on the other side of the equation, so growth of fees and growth of demand, etc. The 28 million typically means we stand still in terms of our budget. So other bits that you'll be, I guess, more interested in, and again, we are slightly, behind the curve in terms of the autumn budget, which will announce a number of these things, will be where national living wage drives us to. So we've got a slide on that in the moment. And equally, the other main drive that we see in terms of fees, obviously, is the broader measures of inflation. So CPI at the moment is holding at 3.8%. OBR estimates quite early in the year, so May, when they did their last estimate, suggested it might come down to 2% for 26-27. But clearly, with current levels of inflation still hovering just under 4%, we wait for the November estimate to see what the OBR expects that to be going forward. And then hopefully you're all familiar with, but if not, I will give just a little plug to, is the Fair Pay Agreement. So government's consultation for that is out at the moment. We as a council will be responding to that consultation, but hopefully you either through NorCA or individual as providers will engage in that process. Clearly, when it was first announced, we thought it might be relatively sooner than when it actually is going to be implemented. So the implementation at the moment is currently set for 2028. They've advised nationally that 500 million would be available to local authorities as part of the funding of that. But of course, the difficulty in all of that is they haven't agreed the scope and definition of roles and what their actual intention is for how much that should drive wages. 500 million does not go very far, as you'll be aware of, in terms of a national scale of that. So that's the thrust of our feedback will be, we like the ambition of increasing wages, but actually it needs to be fully funded so that you as providers can pay it, and we as commissioners can give you the money to pay it. So that's the budget context. Next 2 slides really just touch on again national living wage and CPI. So this is just the graph of what national living wage has looked like. As I said, the government have confirmed what national living wage will look like for April 2026, but every year the Low Pay Commission obviously recommend what they think it should be, and they give us a range. At the moment, their central midpoint recommendation is a 4.1% uplift. Just to flag, the 60 to 70% reference of proportion of cost is before we've reviewed the survey results for this year. So just in case that jumped out when Becky goes through the survey results later. But proportionally, we look at national living wage being somewhere between 60 and 70% of your ongoing costs, and that's slightly different depending on what market. So obviously for home support, you'd expect that to be a slightly higher proportion compared to something like residential care. Next slide. Sort of touched on this, so this is interesting, the sort of mapping of where we've been in terms of current inflation levels, and the bit in blue you'll see is just the current level is and where the estimated is. So OBR, as I said in May, suggested it may fall to 2%, but we will refresh that when they do their November estimate normally a lot of these things are linked to the autumn budget, so policy statement and the national living wage announcements. You'll probably see that drip fed through BBC, etc. So that normally gets dripped out a couple of days before the autumn budget, and equally the OBR will then produce its forecast for future years. Next slide. So I think this one's last one from me. So, you know, overarching summary, as I've talked through, you know, the budget for local government is still, you know, extremely challenging. We do spend a lot, you know, so I don't sit here and say we don't have any money. You know, we spend 700 million every year, but it is still really, you know, extremely challenging for us when we look at how much demand we have and the price of meeting that demand. Still don't have any actual certainty on the level of funding for us. But you know, that's nothing new for us. You know, it's what we've had to do in every one of the last 10-15 years we've been setting these budgets. As I said at the start, you know, really important that we get some feedback, and really important for the engagement that you guys provide, either through these sessions or through this survey. You know, Chris Jones and others have, you know, some real statutory duties under the Care Act around you know, what we need to do as part of the market. Ultimately, our fee uplifts are a decision for our elected members. So again, similar timescales to previous years. We recognise that we need to give you sufficient notice to be able to plan for your businesses, but equally we have to go through that political process. So January time, it'll be a late January cabinet paper that will ultimately make the decision on the fees. I think that's it for me. So I'll hand back to Becky, but please do pop any questions in the chat.
Great, thanks, Leon. Should we just pause momentarily to see if there are any questions for Leon before we move on to this next section?
The difference between net and gross when you reference your budget.
So obviously the mathematics behind it, you'll be able to do, you know, it's about 400 of income. The primary drivers of that are threefold. So we get government grants as part of our income. So we get something called the Social Care Grant. We get something called the Better Care Fund. So we get a variety of grants. We then get client contributions. So you'll be aware that social care is a means tested service. So every year we get around about 100 million from people that are financially assessed to pay contributions towards their social care costs. So that's in our budget. And then we get funding from the NHS. So a number of pieces where we're integrated, where funding flows from government to our local ICB primarily, so the Integrated Care Board. And then we negotiate monies from that to provide services that are integrated in our approaches. So that's the main sources of our income.
And Leon, correct me if I'm wrong on this, but typically one of the things that scratched my head a little bit when I first started kind of working with local government is the way that budgets are displayed are inverse of how businesses and independent organisations tend to do, in the sense that you tend to list expenditure first and then offset income sources against it, rather than a kind of income and expenditure, income at the top kind of model, which can just be a little bit head scratching as you're going through the paperwork in the first time.
Yeah, it's certainly. So obviously, as a local government, we don't have that, you know, thing at the bottom that says profit or loss. We have to set what we call a balanced budget, and by law we have to set a balanced budget every year, which is slightly different to other parts of the public sector. So the NHS doesn't have to do that by law. They can run at a deficit. So our bit works with, you know, how much we're spending on all of the services and statutory functions, and as you say, John, towards the bottom of that we then talk about how we're funding that. So primary funding sources outside of what I've described for social care would be, you know, government grant funding or council tax. So what you'll probably see is, if you look at any budget reports for the county council, you'll see it comes all the way down to probably a net budget of 380 odd million. And the 380 odd million is then filled by the council tax expectation, and that's the thing that then, you know, drives your individual bills that you get through the doors. The oddity you'll see though is that actually your council tax bills don't come from Norfolk County Council; they'll come from the districts as collecting authorities. But within there, you'll see a list of, you know, Norfolk County Council is one of those, alongside police and crime commissioners and obviously the districts themselves. So it's a weird arrangement in terms of districts collect all of the money on behalf of the county. But as I said, you know, if we become three, 2 or 1 unitaries in the future that will change slightly.
Perfect. That's a question in chat about uplift for a specific kind of client.
Yeah,
I guess
for me.
Yeah, I was going to say, I don't know who wants to pick that up.
So we'd need a bit more detail to be able to answer it fully, Leanne. But I assume you're talking about a client that you've been providing support for, that you either want to be able to claim more hours for, more time. Is it a fee uplift issue, or is it an issue in relation to the amount of care that you're providing currently? Okay, it might be that we take that away from here, because if it's a specific client issue, what I'd want to do is to understand the detail of that a little bit more sophisticatedly, to then be able to provide yourself with a response that makes sense. So if there's a way to just grab your email address, if I put mine in the chat, you can just email me with the details and we'll take it forwards that way. Is that helpful?
I think that would be helpful if wanted to drop emails in chat.
Yeah, because it'll be a specific issue, which I think will require us to have a look at the individual case to ensure that what we've done is provided the right response. So I'll take an action to do that, John.
Okay, but Chris, if you just clarify the general point. So my understanding would be, so obviously you've got the number of hours a client has and what you are paid per hour, per those hours.
Yeah.
When NCC makes its annual financial uplift.
Yeah.
So that 20 quid goes to 23, whatever it is.
Yeah.
That uplift should automatically be applied to existing clients.
Yes, that's correct.
Okay.
So what happens is procurement will go through the process of amending all of the CPLIs that currently sit on the system at the point where the uplift is applicable from, and then that uplift will then be applied to all of the hourly rates. And in home care, that's a good deal easier than it is across residential nursing provision, because you have sort of, in the main, you've got fixed rates for the delivery of NCC commissioned activity. So the uplift gets automatically applied and then the CPLIs get amended. The only difference in that is in relation to things like night sits or living care, for which NCC doesn't prescribe the rate that providers would want to charge us, and where there are issues in relation to uplifts that providers feel they would want to have applied to night sits or living care rates, they need to contact NCC separately, because the automatic assumption is that the uplift is applied to those rates, but it isn't. So we need to have separate conversation around that.
So if it's a straight hours at rate kind of issue and your rate hasn't kind of got, that's likely to be the mechanics haven't quite worked, and we'll kind of pick that up as opposed to wider issue.
Yes, but each portion of the market gets sent a fee uplift letter outlining the percentage of fee uplift that's been agreed for the year ahead, and the date that will then change from, and then what that then does to the rate. So our new rates will then be, you'll be notified of those rates, and then if there are any problems with payments against those rates on the portal as you go forwards, then you should just come back through to NCC and we can sort that out.
And I'll just do two kind of updates to, I think, Leanne's kind of other points, and then move us on. But where I would interpret, so she's referenced about back pay if we've had a mechanical issue. So where I would tend to understand that is if contractually a fee should have gone up and it hasn't. Yeah. One, the back pay on that would be owed to the point where it would be owed, and then secondary statutory interest would be owed on any payment elements over the 30-day requirement paid by the local authority.
Yes, that I believe is consistent with the contract around our sort of payment terms, I believe. But I think the key bit to just reflect on is that if there are challenges around amounts of funding that we're providing or amounts of payment that we're making to providers, particularly in home care terms, as this meeting's about that more generally, I would just recommend that you come through to NCC for a conversation around it, noting that sometimes the frustration from providers across the home care market and other areas is that it's difficult for us to come back to you. So I'm offering, from a commissioning perspective, for contacts to come through to us where you're finding it challenging to get a response through the normal payment email addresses or contacts, so that what we can then do is look at individual circumstances, because what we want to make sure is that if we've got problems in that regard, that we're resolving them as quickly as possible, because what we shouldn't have is any issues in relation to what we're paying and how we're paying it. And I would make a commitment just to look at any of those bits individually.
Okay, you're going to point in terms of responsiveness. We have now got as Norfolk Care Association, a meeting in the diary with Lorraine Barrett, who's the, I'm going to say head of social work as a job title, senior social worky something or other. Director of social work, because this issue around package review and responsiveness to package review requests is also broadly significantly coming up, aside from any issues with the mechanics of payment.
Yes, and I'm aware that that's an issue, and we have got specific posts in place to deal with payment disputes and challenges, particularly across residential and nursing, where that will also be a problem, John. But what I would want to do is to make sure that we're sort of leaning into that conversation as far as it's possible, because from the commissioning side of things, we've got a clear mandate from my perspective to ensure that we are being as good a customer as we can possibly be, and that would include what we're doing in terms of responding to requests for review and reviews of packages where there is a request to either go up or down in terms of the number of hours that are provided. And obviously the circumstances around that are different for home care as they are in residential nursing, but of course we should have the capacity to deal with both issues.
Perfect. Becky, if I hand back to you to take us through this part of the presentation.
That'd be great. Thank you for the questions, everybody, and please do keep them coming. This is an opportunity, while we're here, to be able to answer as much as we can. So thank you for that. Okay, so this next part is where Abby and I are going to just take you through some of the feedback from the Sector Pulse survey that we launched last month. So this is the second time that we've run this survey locally. You might already be familiar with the term Sector Pulse survey. A few different organisations use this as a term, but Care England have actually been doing a very similar survey for a number of years. And last year we had a little look at the insight from Care England and thought it was really useful to try and help us understand the operating environment that a lot of providers are working in at the moment, and decided to try and do a local version. So last year was the first time that we did that. We came to the sector subgroups last year to share that insight, and we're doing the same again this year. The good thing about that is that it's now starting to give us a bit of an indication as to not only what providers are telling us, but how that is changing over time. So that's what we're going to share with you today. We've got about 8 slides or so, and like I mentioned, do feel free to ask questions as we go. So there were 24 questions as part of the Sector Pulse survey, a mixture of multiple choice questions and lots of opportunity for providers to tell us more about what they're experiencing, and we'll take you through that now. So 338 providers this year engaged with the survey. That was a 15% increase on last year, which was great. And what we mean by engage is opening the briefing that came along with the survey and either starting the survey or completing it. That did then translate into 136 providers that fully completed the survey. That's a 5% increase on last year. We had 32 responses that came from the home care market. I would say that that is the only part of the sector this year that actually was less responses than the year before, but still gave us a good amount of insight to be able to share with you today. So this is just a quick slide just to give you a bit of an indication as to who completed the survey. So everything that you're going to see in the next few slides is all bespoke to the responses that came through from home care providers specifically. So 34% of the people that completed the survey were owners proprietors from home care, 19% were managing directors and 28% were senior managers, and then the remaining split were between different roles such as finance directors and executive directors. That was a relatively similar picture to the types of people that were completing the survey last year. This is important because what we ask throughout the survey is that it's completed by somebody that has a really good understanding of the business in its entirety, so both some of the workforce challenges, but also some of the financial detail, because it's really important to us that when we ask the questions around finance, that we get as much accurate information as possible. So getting the right people to complete the survey is crucially important. From an organisation size, Most of the home care providers that completed the survey were on the smaller side of businesses, so employing between either 10 to 49 people or up to a maximum of 249, but that lower number representing the greatest proportion of providers that completed. And that translates across to the next question, which was around how many people were providers offering care and support to over the past 12 months. Moving on to the finance section. So as Norfolk County Council, when we model some of our potential scenarios for our fee review every year, we utilise a range of different insight that we've gathered over years. So things like cost of care exercises, different types of things that we've spoken to providers about, surveys such as this one, and that's to try and understand, in terms of your total operating costs, how much of your costs are spent on staffing related expenses and how much of those costs are non-staff related. And we use this insight to try and map how those costs are changing over time and to try and understand a bit more of the detail underneath how those costs are changing over time. This year, home care providers have told us that 76% of your costs are related to staffing costs and 24% relating to non-staff costs. This was a similar-ish position to last year for home care, so slightly more being spent on staffing costs than non-staff, but it's remained relatively consistent over the 2-year period. And this next slide was asking providers to look at the last 12 months. So looking back over the last 12 months, we asked questions about how those expenses have changed. So 69% of providers told us this year that those staff-related expenses have increased significantly. And what we meant by that is over 5%. And the bit in brackets is telling us how that compared to last year. So 18% more providers told us this year that their staffing related expenses have increased significantly, and then a 16% reduction in the number of providers that told us that that was a smaller increase, but still an increase. And from non-staff related expenses, so 44% of providers have told us again that those expenses have increased significantly, which was a 10% reduction on last year. But 44%, another 44, suggested that those costs have increased slightly. So what I read from that is that staffing related expenses have continued to shoot up, and more providers are telling us that that's a increased cost. And although non-staff related expenses are still high, that is not quite as high or reported as quite as high as the year previous. The top 3 cost pressures that you told us, there was a list, about 20 of them. Top 3 that came through this year were the same as last year. So workforce related cost, insurances and fuel remaining as the top 3 pressures. And the ways in which that you told us that you're dealing with some of those cost pressures are similar but not quite the same. So number 1 was the business as usual, if you like, internal efficiency savings. 75% of providers telling us that that was the number 1 way that you're having to deal with those, but also utilising reserves and growing or increasing your income. I have added one more in this time because there was another option which was really high up on this list this year, which was different to last year, which is that providers are now telling us that one of the ways that you're dealing with it is by also curbing investment into the business. That was a higher proportion than what we saw in previous year. We asked around surplus and deficit, so looking at the business overall. So we asked in the most recent 12-month period, are you operating in a surplus or deficit position, or not to tell us if you were unable to do so. But 37.5% told us that still operating in a surplus position at the moment, but that was nearly 10% less than last year. And 37.5% are operating in a deficit position, which is 2.5% more than last year. We did also have an increase in the number of providers that didn't answer that question. And the final point on this slide was that around that changing of financial positions. So 41% of providers have reported that reported, sorry, a surplus position, have told us that that position decreased significantly in the last 12 months, and that was 70% more than last year. So what that's telling me is that the more providers are operating in a position where their surpluses are reducing significantly over time. But we did also have a quarter of providers saying that their surplus position had either stayed the same or increased slightly. So a mixed picture is what I'm seeing there. I'm going to hand over to Abby for the next couple of slides. But if any questions at this point, it's probably a good opportunity just to pause.
My one, I think you can probably guess what this is. So I think the slide a little back looked at the ratio from providers in terms of staff to non-staff costs was 76 to 24.
This one, yeah.
Yeah. So last year, what ratio did you use in terms of the fee uplift for home care providers?
Don't know whether I've got that to hand. What I would suggest is similarly to last year, what we found was that what was self-reported through the survey, the ratios were slightly higher within what was being self-reported on the staffing side than what our current modelling assumptions were.
Okay. John,
what I do know is we didn't use 70-30. If that's the question, we didn't use that methodology in last year's fee uplift in terms of calculating the percentage uplift.
You put your hand up.
Yeah, thank you. Rebecca, are you able to give us a sort of high level view of the correlation between the size of the provider and the those who claim that they're making profit or not?
That insight is definitely within what we can analyse, is what I would say. So the survey, I can't, what's the right way to phrase this? I couldn't tell you what that is now. It's a simple answer, but we do have that insight available. So for these sector subgroups, we do this sort of high level overview to give a summary really of the overarching findings, but we would have that information to be able to have a look at that correlation. It'd be interesting to see.
So can we ask that you do that and come back to us with it?
That's something that would be of interest to the group. We can certainly have a look at that. So it was specifically looking, say the question again, so I can make sure that I get the right thing. So it was the size of organisation.
Yeah, so just really, so the numbers are really interesting, but
yeah,
the context around the size of the organisation. So if a percentage is saying they're still making a surplus.
Oh yeah.
How many of, or roughly, you know, is there a correlation between those and larger or smaller providers? Because my observation, and it's not, you know, I think probably everybody on the call understands this, that scale is an issue for home care providers particularly. It's very difficult to make a surplus if you're not over a certain level of hours, and I'm noticing a lot more consolidation in the market, or certainly activity from large investors wanting to buy smaller services and come into the market, probably because the economy is suffering. It tends to happen when people have money they want to invest and they're looking for a safe, what they consider to be a safe haven for it, which would be care. That's obviously of interest to the council because it's a direction of travel that, depending on your your belief system, you might consider to be good, or you might consider to be bad. I think history's told us it's not a good thing, you know, from when this happened in the past.
I can certainly look into that part of the analysis and share.
Because obviously in relation to home care specifically, NCC has embarked on a kind of prime provider journey. And I think there has been reference previously, although I might be wrong on this, in terms of the MPS, in terms of a phrasing around a more consolidated market or the challenge of a lot of small providers. So I guess on a policy direction point, where is your market view?
Well, the market view is that we're implementing the principal provider model, and that is our strategic view of how we want to deliver home care across the county, John. So it is using that principal provider model to deliver in effect 70% of the care hours that are in each of those primary care network areas, which is how the block around that arrangement is set up. And that what we are then doing is using a smaller, more strategically focused framework market to deliver the remaining 30% of the care in those areas, as the market under the original framework had become quite fragmented in terms of multiple providers across the entire county in an entirely spot-based model, which didn't allow NCC to strategically pull any of the contractual levers around contract management. Particularly was an issue for us, but particularly our focus around quality, sustainability and capacity was also an issue, because the market was focused on the areas where work was available and where it was financially in some cases more sensible for providers to sort of base themselves and footprint themselves across the county. So that model had some challenges, which we are hoping we've resolved through a strategic approach to the principal provider model. I will quite happily pick up conversation with providers either individually or collectively if they want to talk to us about our strategic direction, but we will be re-outlining that position as part of our published market position statement, which is due to come in early in the new calendar year. But I mean, we can pick up a conversation with providers where there's an issue around how that market is structured and what our approach is.
I think it's just useful to make it really clear, you know, that there is a for better or worse, you know, and we can have individual views on this, that NCC in terms of the home care it purchases is essentially seeking a market where 70% of provision comes from half a dozen providers.
Yeah, I mean, you can't. It's difficult to specify exactly how many providers will be part of that principal model as you go through the remainder of the procurement work that's required. So, so we're currently just off the back. We're just coming out the back end of the procurement for the South Norfolk area, and then we will move into that in the Norwich area in due course across 2026 and into 2027. But yes, that's our model is strategically focused around the delivery of our principal provider model, because we feel that actually from a model perspective and from a delivery point of view, we will get much better value out of that model from a quality perspective, but also from a financial one, and that providers will have the certainty of a 10-year investment in a strategic programme of work that is intended to reshape how we deliver home care in Norfolk. I appreciate entirely that that's challenging for providers, particularly where we've been where we've used a market which is made up of a number of smaller providers who will inevitably feel that there are sustainability and market issues that presents them in terms of closure, in terms of all of those other kinds of things. But what I would want to do is be pragmatic in terms of how we are seeking to manage some of our responsibilities to a sustainable market. And we do have other things across our home care delivery that are available to the existing framework provision, including night sits, day sits, mental health provision, LD provision, and also some of our CFBO program, which is our sort of reablement market-wide program, are also available to providers on the broader framework. So we can pick up those conversations as say individually or collectively, and I'll more than happily do that whenever anyone wants to talk to us about it. But yeah, our position is strategically the principal provider model in terms of generic home care day-to-day activity.
Right.
It's just a few more slides and then we can pause again for any others, so there's further opportunity.
Can I just say that if John, particularly, if you wanted a discussion around any of that separately, I'll more than happily find the time to pick up the conversation.
Thanks for that. Okay, so for the last couple of slides, handing over to Abby.
Thanks, Becky. So the next slides provide some further information and feedback. So if we focus on staff-related expenses first, and we've got three key theme areas here to talk through. So pay and retention pressures. Recruitment and retention remains a major challenge. Providers report higher pay expectations fueled by the cost of living increases and competition from other sectors such as retail and hospitality are driving up staff costs and narrowing margins. So we have got some specific quotes on here, which I will just talk through on a very high level. Everything is much more expensive, wage increases for office staff and carers going up every year in line to fall in line with the cost of living. Changes needed to compete with retail have led to employment costs rising by around 5%. Provider reporting they'd love to pay more but cannot absorb any more costs. And again, a reflection there around cost of living and competing with the retail market. International recruitment costs, so reliance on overseas recruitment continues, but providers are reporting that cost and complexity is increasing related to sponsorship fees, compliance requirements, and rising accommodation costs, putting further strain on budgets. So again, some feedback there specifically from providers around the licence fees running into thousands, having to look at international sponsored workers with an investment over £5,000 per person, and reliance on overseas staff, but the process becoming more expensive and complex. The third theme here is around employment legislation and HR costs. So forthcoming employment law changes, including the Employment Rights Bill and the expected employer increase related to sick pay and guaranteed hours. Providers are also reporting escalating HR training and management costs, adding to that financial pressure. Again, some direct feedback here around training expenses going through the roof. HR issues have risen. Expected future increase of costs for the national minimum wage. And again, a reflection there around the Employment Rights Bill, anticipated extra costs at a time when margins are already narrow. Thanks, Becky. So moving on to look at non-staff related expenses, and we've got two key theme areas here. So rising core operating costs, so costs including rent, energy, insurance and utilities are remaining stubbornly high. And weather extremes are increasing costs, so looking at actually paying for heating and air conditioning as part of those utility costs. PPE and office rent being high. One provider here has reported they've had to relocate premises to save costs. All costs driven by energy prices, inflation, and national insurance. And providers reporting that they continue trying to manage their costs, but that's becoming less and less achievable. The second key theme here is around administrative and compliance burden. So providers responding to the survey have reported a growing digital and reporting requirements from regulators and commissioners. Going digital has meant an increase in admin costs to monitor and manage the team. A report there around extortionate costs for social value portals and compliance reporting, and CQC and governance charges are increasingly becoming a higher percentage of overheads. Thanks, Becky. So the next slide there, as part of the survey, we asked organisations if they are considering exiting the market. Have they considered exiting the market in the past 12 months? So the response from the survey that we can see there is 53% of providers said yes, they had considered exiting the market in the past 12 months. And the comparison there with 2024 sees a 6% increase in the answer to that question. On the slide, we've got some further feedback that underpins the response to that question. So there's unsustainable financial margins, reporting rising costs and static fee levels. There's the workforce and shortages and pay pressures. So ongoing recruitment difficulties and inability to offer competitive wages, pushing some providers onto the brink there. Rising compliance and technology costs, as we talked about on the previous slide. So providers are citing escalating costs of digital systems, training and governance requirements, tying them into long-term contracts. So recognising the need for technology compliance, but the cost that is increasing to providers there. Some feedback around personal and emotional strain, particularly here for smaller or family-run businesses. The stress of maintaining care standards is becoming unsustainable, really challenging. And the market or the wider sector fragility there. So many long-established providers are exiting the market, which is fueling some concern around the overall sustainability. Thanks, Becky. Okay, so looking ahead to 26-27. So looking at staff and non-staff related expenditure. So 44% of providers reported that they'd expect staff related costs to increase significantly, so more than 5%. And 41% of providers expected non-staff related costs to increase significantly by more than 5%. On the right-hand side of the slide, we've just got some specific feedback here around how we can work differently together. So I'll just talk through this very high level. So ensuring fee levels remain sustainable and reflect true costs, keeping up with rising workforce and operating costs, improving timelines and accuracy of payments. Again, this is something that's come up previously in the meeting. Strengthening partnership working and early involvement. So providers reported they want to be involved earlier in commissioning around discussion plans, fee settings and systems changes to make sure that the shaping sustainable solutions around that. Supporting the diversity of the market. So greater recognition of the contribution made by smaller and community-based organisations. Simplifying the system and improving communication. So making sure that there's digital processes, clear points of contact and consistent communication as part of that working together. And the last point on the slide here was around a shift towards person-centred outcomes-based care. Providers encouraged to work with NCC colleagues to move away from that time and task model towards more flexible outcomes-focused care. Thank you, Becky.
Thank you. So that's all of our slides. And we wanted to again just pause for a few moments, just sort of noting the time that we're on at the moment, and that we've got a few more minutes that we can stay and answer a couple of questions, but then we'd like to be able to leave you with NorCA colleagues to continue that conversation. But we're just keen to hear, so having heard the feedback that we've summarised from the provider survey, overall, does it feel like it resonates with your own experiences? Are there things that feel different that you'd like to share, or examples? We'd be keen to hear from you.